Okay, I'd like to call the meeting to order. This is the Madison the Academy Community Center Building Committee. And we have a number of items on the agenda. Everyone should have the agenda sent to had been sent to them. Primary on the list is Scott Cochran, but there are a couple of business items I'd like to take care of first, and I don't think Scott wasn't on one last time I looked. First thing, of course, is public comment. Are there any comments from the people who have joined us who are not on the committee? I believe you have to raise your hand so that Jacqueline can see you.
Yep, I have a hand raised. David Buller. I'm going to unmute him.
Are you able to hear me?
Yes.
Hi, my name is David Buller, and I'm a member of the Madison Youth and Family Services Board. And I want to thank you for taking the time to serve on this committee. It's hard to imagine how much work will go into reopening the Academy School as the community center we all approved. And we owe you a heartfelt thank you for being such an important part of bringing this wonderful vision of a shared community space to reality. Excuse me. I believe I'm joined by several of my fellow board members, and we're here to show our support for the planned use of space by MYFS as it was presented to and voted on by the community. I've been a board member for over 10 years, and the lack of adequate appropriate space has been an issue since my first day on the job. This is an everyday issue. Just several weeks ago, as we were walking out of Scott Cochran's office after an executive committee meeting, we walked through a program that was going on in the lobby because there's really no other space for that to happen. Over the years, plans have been made, multiple studies have been conducted, and yet no real progress has been made until now. And the space that is currently allocated to MYFS and the Academy Community Center plan addresses the unique needs of the organization. While we understand that there may be changes to the final design of the building, we believe it's essential that the final plan continues to meet those unique needs. And I ask you on behalf of MYFS to keep this in mind as you continue to evolve and develop the plans. So thank you again for your time and effort and for allowing me to share my thoughts with you tonight.
Thank you, Dave. Other public comment, raise your hand and Jacqueline will recognize you.
I'm not seeing any other hands raised.
Okay. I'd like to move forward with the approval of the minutes. I've read everyone should have had a copy sent to them. And I believe I need a motion. And a second.
Second.
And any discussions, any corrections? Any all approved?
Aye.
Any objections? Hearing no objections, it's the minutes are approved from the November 14th meeting. There is one item 6 I'd like to bring up because up to the top because Dave is, as I said, Dave and Al may be leaving, and that is the approval of the 2023 meeting schedule. Everyone should have had a copy of, let's see if I have a copy. Everybody should have seen it and had a chance to at least look at it. It is for this, what is it, the second Monday and the third Tuesday of every month, with a couple of minor exceptions because of holidays.
So I will move to change and move item number 6 to after item number 2.
Oh, I have to do that. Didn't
Yes.
know that. Thank you, Joan.
That's okay. I'll keep you out of there.
I think I need a second on that. Or
Yep,
do I?
Second,
Any objections?
but I think it's the 4th Tuesday, if I'm not mistaken. No?
Mhm.
Take a look.
Well, we're moving it in, and then we can discuss it in motion to approve it. So we're just moving the actual item to be discussed.
Okay.
Okay. I must have made the wrong copy. The second Monday and the fourth, I had the second Monday and the third Tuesday as the, on the final copy that I have. Am I wrong in that, Jacqueline?
Can I share my screen so we can just
Sure.
look at it quickly?
Okay, so let's just approve the moving of the item.
Oh, okay. Um,
Yeah,
uh,
there-
any, any objections to moving the item number 6 to no, essentially after number 2. Hearing no objections, it's approved. So we will move. Now, you were going to share your screen, Jacqueline.
Yeah, if I could, just so we're all on the same page. I'll make this bigger. Everybody see that?
Got it.
Okay, this is the one, right?
Yes, you are correct, Eileen. It's the second Monday and the fourth Tuesday. And this, that was an
Yeah.
earlier version. I'm getting rid of it.
Okay. Awesome. I'm gonna stop sharing.
So first, I think I need a motion to approve the,
Motion. Motion to approve the 2023 meeting schedule.
One sec, before we approve, I just want to make sure everyone's aware that the April 10th is the week of school break. So I know I'll be out that week. I assume we'll still have a quorum, but I wanted to make sure that we weren't going to lose a bunch of team members that week.
I think we have to, that comes with after discussion. I think first we vote to approve it. And then there would be discussion. Is that, so I have, there was a, yeah. And then there would be discussion. And if there's any discussion, we can, and then there'll be a vote afterwards.
Oh, so we vote to approve it and then we talk about it and then we
No,
vote again?
we motion to approve, we second the
to approve.
motion, we have a discussion, and then we
Got
can
it.
amend the schedule as approved, as mentioned. So
Okay,
we can,
thanks again, Joan.
that's okay.
I'll second,
That's why I'm here.
I'll second it.
There we go. Okay. So good
Now we
discussion.
can have a discussion.
Yeah.
And I'd like to add that in part of the discussion, that this would be an approved schedule, and these would be the meetings that we would schedule, but there's nothing that would prevent us from moving a meeting or adding an additional meeting, especially as we go through the RFPs for the architect and then for eventually for the either a general contractor or a construction manager. So, well, and if we lack a quorum on April 10th, we could always try to move it from there to another date or cancel the meeting if we lack a quorum. But again, that would be something we can do, you know, as we get closer to that date and we know who's going to be here and who isn't.
Joe, just for, I did amend the schedule for the architect selection to align with the schedule that you're discussing tonight. So the 9th and the 24th are new dates in our architect selection schedule.
Okay, good.
Mhm.
Any further discussion? All in favor of accepting the dates as presented for this, for the second Monday and the fourth Tuesday?
Aye. Aye.
It looks unanimous. So the motion is approved, and we have, we will make that, we will publish that as our schedule for the, and so the next step would be for Jacqueline to publish that schedule on the website for our future meetings.
Thank you,
And-
Jacqueline, for all the work on this.
And as I said, if, you know, there's nothing that would prevent us from moving a meeting or scheduling a special meeting to cover any, or canceling one of these meetings to make sure we cover the business we have to go through. Okay. I believe then I can go write down the agenda. correct me if I'm wrong, someone, but we have Scott Cochran next up to discuss, to talk about, answer questions about his program activities and his need for, and how the Academy School Community Center fits into his needs.
Hi, everybody. It is an absolute pleasure to be here tonight. And as our board chair just mentioned, Dave Buller, we know what a monumental task you all have. I also serve on the Academy Advisory Committee along with Austin Hall. So been very aware and participating in that effort. And you'll hear more from Bill Stableford later tonight on how all those efforts are going. So I think that my role here tonight is to help you all understand how we came to having the space that we were allocated in the Academy Community Center. As I often come into these kind of public meetings, it is always on my mind that not everybody is always as aware of what Madison Youth and Family Services is and what it does and its purpose. And rather than throwing a lot of numbers and terms at you in a short period of time, what I would like to do is run through a set of 5 slides that would just give you a little taste of who and what we are. And then I'd like to get into what space we have and how we see that space working within the larger community center. So is that okay with everybody? All right, I'm gonna give this a shot here then. All right, can everyone see this? Oh, wait, maybe.
Yes.
Okay,
Yeah,
so
here.
play, okay. All right, in all fairness, these slides I'd actually created for a different presentation. So what I did, realizing I had a lot of information to share with you, I just pulled some that I thought were gonna be the most helpful. So this was gonna be for an overview for Board of Finance. That actually, I'm hoping will still happen, but I'm not sure will. This is an overview in terms of our staffing. So we are the Youth and Family Services. We have our own mission statement. We have a foundation in the Search Institute Developmental Asset Model. We're data-driven. We are all about youth empowerment. We're community-focused. The main thing I want you all to focus on is, in terms of our staffing, currently we have 11.66 full-time equivalents. In addition, we have, this year we have right now 3 interns, and we have 2 more that are going to start over the winter. And we have, I believe, 2 contractual clinicians plus a contractual clinical consultant. We break down our main agency into 3 main divisions. We have our clinical services. PYD stands for Positive Youth Development. That's our prevention arm, and a division that we know as community support. Our clinical services, that is our full-time assistant director. We have 2 full-time school-based clinicians. That's what that term stands for, the SPCs, and a parent support counseling position. On top of that, we have all of our interns and our contractual therapists. It's been a real challenge over these past couple of years to stay fully staffed and meet all the demand for clinical services in the community at present. I'm sure that you're all aware we're in a mental health crisis, and nowhere that I'm aware of is more in the middle of that than we are. We are currently running with about 25 families on a wait list for our clinical services, and that is that list is watched over and checked upon by our clinical director Angela Herhern, and is added to quite frequently. To give you a little taste, we had we served 185 individual cases. Those are formal family and individual therapy. Last year, we counted an additional 123 that were served as outreach. That's mostly youth that would engage in our services without more formal consents and treatment plans being set up. That includes a lot of the work that we do in our work directly at the schools. In terms of our prevention programming, we have a full-time assistant director and 1 full-time prevention coordinator, and then we have 2 part-timers that also contribute quite a bit. They provide 36 distinct opt-ins. So those are programs that youth do not have to go through, but can opt in on their own. plus another 9 classroom-based programs. And what it amounts to is that we reached 100% of the school of the youth that are enrolled in Madison Public Schools last year by our staff. Moving quickly to community support, that's another full-time assistant director. And under that heading is also our social services component. We also do our drug and alcohol coalition, which is known as MAID. That's all of our drug and alcohol prevention. And the reason that's separated out of prevention work that we're doing in that other division is because almost everything that we do for substance abuse is really oriented around grants. We pull in a lot of grants and do a lot of work off grants. To give you an idea, we had 141 households that were served under our social services just last year. And that coalition I just spoke of had 14 distinct programs or events that reached almost 2,000 individuals, in addition to a radio podcast that reached over in a regional campaign over $750,000. And these are all numbers that we can verify, by the way. These services are defined under a state statute. And in order for us to get grants through the state, we have to be meeting that definition. So you can see that here. Essentially, a youth service bureau does serve to assess the needs of a community and then work to provide whatever is needed or to make or ensure that whatever is needed is there. We are part of the Connecticut Youth Services Association. That's 104 youth service bureaus across the state. They serve over 150 towns. And CYSA is the fiduciary for all that state funding. So that money moves from the state through CYSA to those YSBs. Fun fact, I happen to be the president of the Connecticut Youth Services Association as we speak. I'm going to skip through that. I wanted just to point out we have an early childhood trend for mental health. So we do keep quite a bit of statistical information right now. One of the scarier ones is the age of our typical youth recipient of our clinical services. So if you just look here, you'll see over time, first of all, that our referrals have been going, or treated families have been steadily going up, but you can also see a trend where that blue bar, those are inquiries for our outpatient clinic of ages 0 to 10. So you can see the percentage of cases that we're serving as 10 and under going steadily up. And that is very germane to our space needs and how we operate now, because we have to be able to work with kids at a much younger age than we were maybe 10, 20 years ago. Want to give you a taste of what we do prevention-wise. So QPR, it's an acronym for suicide prevention. We did a lot of work with that last year. That was one of the main focuses of our programming. So we trained 1,100 people. We had youth involved with that. And we also trained 95% of Daniel Hand students in QPR last year. So that's suicide prevention. It's a model of suicide prevention. We are currently, we have staff that are working along with the creation of a Madison Youth Professionals Coalition that includes the library, the Arts Barn, the Madison Diversity and Inclusion Club. We've expanded mindfulness classes in early kindergarten and then up to Brown School this year. And just last summer, we had 116 youth volunteers that provided 302 hours of community services. And we trained one of the plans that we have this year is to train 112 kids for the youth advisory program at Daniel Hand. Give you an idea, we keep very close attention to our costs, and we can look at about 25% of our total budget each year as being offset to that degree, 25%, with either our clinic revenue or any of the grants that we pull in. So we keep an eye on the cost to the Madison taxpayer. Also, it's important for you to know in terms of assistance through social services. So this is to all Madison individuals based on a financial need, including a lot of families. Important to see that the pre-pandemic number, the number that we reached during the pandemic, and where we were last year for the fiscal year in terms of the number of households assisted. Also want to point out that we move money from mostly neighbor to neighbor Madison Foundation, from a number of civic organizations in the community. So the town spends about $17,000 in terms of the local relief that's provided. We're able to connect and partner and move another $60,000 to the families who are most of need in the community. Some of our bigger hits over the years. Our coalition, Drug and Alcohol Coalition, has moved to almost $2 million in grant funding over the last 12 or so years. We moved $110,000 just during COVID to support people during the pandemic, and just generations at this point of youth that have been involved or trained, contributing back to their town. And I don't know how many times that we've responded to grief for grief responses, crisis situations, outreach, and special projects in town. And I think that was all. So that's a little taste of us. To speak towards specifically our space needs, we occupy our main building is at 10 School Street, downtown Madison. We are next door to the Academy building. We get to look at that building every single day. We shoo people away was they're, maybe doing things to the building that they shouldn't be doing. I've been the one that goes in when I find a window open and I try to get it shut and let Bill know that he needs to go back and put up another board. Love that building. We occupy about 2,300 square feet at 10 School Street in that building next door. We absolutely love our building, but it is for long outgrown our needs for our programming. We have three offices in Memorial Town Hall on the main floor. So if you're familiar with the probate court, on that main floor, there's 3 offices just in that hallway that we are allocated to use for our own space needs. And primarily we keep a lot of our clinical services. It's the space over there is probably adapted best to that use. We can't run any groups or do anything much else with that space. It works as clinical space. It's just far from ideal. So it's open to the public. The acoustics are horrible. There's no reception there. And, it's not enough. Like, we need more offices than we have for the number of referrals and the number of staff. So we have allocated about 3,000 square feet to our needs at present. We have no group space of our own. We have no conference room, no meeting space. As my board chair just mentioned, and that's happening actually tonight. We have, and I'm in an office just down the hall, will be about 15 youth and 2 adults that are doing a peer advocate training that I will have to somehow scoot out when I'm done with here without disturbing too badly. We identified the need for more space probably a good 15, 16 years ago. It was a problem. Primarily it was around serving the clinical needs and having office space for youth to come and meet with our counselors. It just has been steadily growing over the years. Even prior to the pandemic, we were seeing increases in mental health issues with our youth, and again, primarily in the younger ages. Why the younger ages is important for you to know. So when you think about what therapy means and what clinical services mean, so we provide family-based, a lot of psychoeducational support, play therapy, things that are really designed at mostly addressing family issues as well as depression and anxiety. Excuse me. If our average age youth who receives those services, I'm really sorry, folks. You need a space designed for that age. You need elements of play therapy. You need a space that's welcoming, that has all of the play elements and things that you would need to do that service. It's not like working with an adult where you can be in a smaller space and just ask them how they're feeling and kind of move it from there. We picked up a lot of those needs because there just is not enough of that in the community. There are plenty of therapists, but not as many therapists that are trained to deal with younger kids, that have the space, that have the time and the training to do it. So it's something that we've had to pick up the pieces on because it was a gap. We identified our own space needs over the years. When I became director in 2016, and I've been here for over 18 years altogether. I've been the director since 2016. We made it a main point to address this because it creates so many issues internally here. Like, whenever we want to run a group, we have to find, we have to know what space and what staffing we have and the need, and then we have to find the space. But in terms of our clinical services, when our clinical director has to take an inquiry, if she's assigning the case to somebody, she has to find the mutual time for that therapist and for that family. Then she has to match it up with a space that can accommodate that within a time. I wish I don't have the chart, but a couple of years ago, we had this graph with the names and the spaces, and it just looked like a big checkerboard that we had to move almost every single week. I can just tell you this, and it's important for the public to know what a monumental waste of time that was, and a stress. In order for us to do the job and the work that we needed to do, that we had to do the extra, all that moving around and finding space. And for a group, we had to do the same thing. We're competing with other civic groups, other town things. So anytime that we wanted to do something, we couldn't do it within our own power. We had to rely on finding, not only doing the program, but then finding the space. The experience, and we got some feedback too from parents who were at times dropping off their kids in one space for a clinical session, and then picking them up in another because somebody had to move. And if you can imagine how a Madison parent might feel about, something as sensitive as a therapy appointment having to be moved in the space, or having to find your kid in that space. And trust me, we do everything we can to make sure people know where they are, what they're doing. And then, like, there are things outside of our control that would create problems, and here we are. So we were having advocated for more space over a very long time. We were welcomed into the conversation by Peggy Lyons when it came to developing potential space in the Academy building. So I'm fast forwarding all the stuff that we went through to get to this past summer. I was really grateful to Peggy. She knew how hard we were working and all the steps we had taken in the long list of things that had been tried to address our space. You may or may not remember that when the Academy came up as a community, so the idea of Academy, one of the negatives that people were worried about was, is it too big of a space? Are we going to attract enough outside interest to cover all of the rooms in that building? And I won't speak for Peggy, but my belief, my feeling is that Peggy knew to sort of anchor a couple of town programs in that building was really important to get that building to be approved as a community center. We had a study done in 2017 on our space needs, and it fully supported doubling our space from 3,000 to 6,000. I think that you've all seen this graph that sort of that highlights all of the number of offices and the purposes and the size. That also came out to about 6,000 square feet. So when I was asked to start talking with the folks, and Mark Zelenka was a part of a lot of those conversations, and probably remembers how red my face used to get at certain points in those conversations. It was so important to us that we had space that was downtown, that was designed to our purpose, and could cover all of our programming under one roof, or as much as it could under one roof. We needed spaces designed to our purposes. So we felt like if we were going to do this move, it was going to need to be for all the right reasons, and to meet as many of the needs as we could, and providing the services that we do. As we came into that building, and we did a few walkthroughs and had more than a handful of meetings to talk this through, we were able to allocate 6,000 square feet. So that was the raw number that we needed for all the things that we felt were important as a part of our programming. So within the 6,000 square feet would include the office spaces we needed to design for our clinical services, the group spaces to meet the demands of our different size groups, which go from anywhere from 20 to 30 youth to 10 to 20 youth, depending on what we're doing. And being able to expand our clinical groups, that also became a growing need for us to meet more mental health needs. We were able to identify, I think it was about 4,000 square feet on that second floor. So the top floor on the side of the building, where we could put most of our administrative as well as our clinical services. So one thing that's important for you to know that we do need in our suite, our own access, so that we are essentially going to have a door that leads into our primary space upstairs. That would be a door that we would view as being locked and controlled by our reception. That is something that we have here now in our own building, and I'm happy to answer questions to that as much as you would like. That space needs to be designed and then essentially carved up into offices. So we're talking about that side upstairs. And I think it encompasses about 3 of the classrooms. I guess if you're standing in front of Academy on the right side as you're facing it. We looked at other spaces in the building. There's no place else to put that much space. It doesn't work on the first floor. And parts of the top floor also start to get broken up as you have to have the elevator and other things up there. And we felt that the art space, there's a room in the middle, if you've been through that building, that was the art room at the old school, which really, if you use it as an art room, saves quite probably a lot of money in terms of, designing and making it a space, repurposing it essentially as it was before. But we didn't want to touch that. That felt like that was space that needed to be with the community center. So we took 4,000 square feet on that top floor. And then in terms of what we wanted to do for our group space, we were allocated space on the lower level in that back corner. So that adds another, I think, 1,500 to 2,000 square feet that we would use for our youth development staff to run all of our group programming, as well as we would do some of our clinical groups in that space as well. And would need every square inch of what we're being allocated. I can't stress that enough. I'm almost worried that we need more space, and I don't want to say that publicly because somebody will want to beat me up. What we have now is just what we think we can work with and work well with. Very happy, very pleased, with just tons of gratitude. We cannot look at giving 1 inch of that space that we're allocated now for any other purpose. We need to be able to design for our own programming. We need to be able to run it efficiently and operate it safely. And that's kind of how we got to where we are. So with that, I feel like I do need to shut up and let you guys ask your questions. And hopefully I covered enough to help you.
So I'm going to ask the same question that I asked Austin, and it's not meant to negate anything that's happened in the past, but if there was a configuration that still met the needs of the separate entrance with privacy and things like that, and had the same square footage, would be amenable to you folks if some other architect came up with a different design but gave you the same type of entrance and the office space and the usage space as well?
It's hard, to be honest, Joan, it's hard for me to imagine that. For one, the space that we've been allocated in the basement, it's in the corner space. It's actually well lit for being on a lower level. And it's actually, the way it's set up now, it would need very little in terms of work. And when we looked at that space, what really attracted us was that it fit. It was almost like it was dropped from heaven. Now, it felt like a compromise for us because it meant that I'm still splitting my staff. So I'd have some staff at the lower level and some staff on the upper level, but we would be under the same roof and in the same building. So like that made sense. We can't be scattershot through the building. So right. That we have, yeah. So I don't know how to answer that. I can't imagine what a design would be. I don't think an architect is going to bust up all the spaces in that building, the classrooms. I would think that would be way too expensive.
Somebody may come in with a different vision that may flip things or reverse things. I'm just trying to.
I mean, I would have to listen to it and look at it and I guess judge it at that point.
Okay.
In earlier discussions, I was asked if we would put our staff in the lower level. No, I'm happy to put some staff in that corner because it meets our needs. And you're not going to run a good mental health clinic in a basement, nor am I going to subject my staff to that on a daily basis. I think that that's the way to run. I also don't think there's enough space on that lower level to accommodate more offices.
Scott, I would like to you say you can't imagine, but when you talk about the lower level, there's a if when you look at the drawing, which I circulated to, there's something called a gallery. It's a long corridor that goes from one end, from the community space on one end to the area under the gym. That gallery doesn't exist. That is there may be one or more concrete walls and some crawl space in between. So that presents a challenge to us right off the top. It's not part of the youth development space, but it would affect access and possibly ADA compliance. If we have to bust through, 2 concrete walls and dig out and excavate, some dirt in between, that may or may not even be possible to connect both ends of the building. So, that's something we're going to have to deal with.
Yeah.
And
No,
it does,
I understand
and
that.
it does affect not so much the space that you have,
Mhm.
but the access to that space. And also the even on the top floor, the elevator may or may not be in the place that we that the first drawings indicated. There may be considerations for where you put the elevator, and the elevator I'm not going to be able to comment about here, but certainly the architect at some point will be able to confirm what is the best location, both for building flow and for structure of the elevator. So I understand you with the current configuration,
Mhm.
you can't, maybe you can't see what that would how that would change, but there are some structural issues that we are going to have to deal with as we get an architect and go through the design process.
So I appreciate that. And I think, I'm giving you my reactions based off of the information I have now. If that information changes, I guess I would say, that some of the thinking that's gone into the building up to this point has included, the general design that was conceived of in these schematics. So I guess I would say that if we did wind up having to move the elevator, that would affect a lot of the other things that may or may not go into that building. It is, all I could say is it's critical for us to have the amount of space. That's what we've been asking for before this. This has nothing, we didn't come up with these numbers based on this building. These were the needs of my department, of our programming that have been, looked at and consulted and pretty well supported into this plan up until now.
Now, Scott, are you going to keep your space in the other
No.
in the other building? So
No.
you're going to focus on here. Okay. We have a couple of other questions. I don't know who was first, Ann or AJ. I'll say Ann.
Okay, hi, Scott.
Hi.
Do you believe your program offerings or the volume of people you serve will be changing in the future?
It keeps going up. I mean, our referrals are going up. At some point you would expect things to level out. We actually thought that they'd be leveling out now. They're not. I would foresee us expanding in terms of our clinical services around groups. That is something that we feel we need to do to reach the volume. I don't foresee it going down. Most experts that I'm aware of in the research is looking at this number staying pretty much steady for what we're doing. So I don't see things, if anything, they're going to go up. Sorry.
Yeah, I guess that's partly my concern, Mr. Cochran. Thank you for that presentation. I appreciate that. It was very helpful to me. That it seems like a lot of the evaluation you've done was pre-pandemic, and that we've now elevated the number of services that we're using. And one of the concerns I have is that your group will almost immediately come back and say, we actually need more space than that. And if we're not accounting for that here, then it's going to really throw a wrench into our ability to separate the space. So given the trajectories that you're seeing, and the square footage that you requested, do you still feel like you can meet the needs of the community with that amount of square footage?
I do, and I think if this is what we have, this is what we'll work with. You know, we've made do with 3,000 square feet as things are now, and we're going to struggle with that going forward. So if that gives you an idea how we work with the space that we're allocated over a period of time, hopefully you feel like if given this space, we will do our very best to make the best use of it, and work within the space that we have. Like that's what we do.
Okay, and I guess a follow-up to that, some of the spaces that you use for sort of meeting room space, is there some opportunity for that to be utilized by other services if that space is not being utilized by your group, or do you kind of utilize that at almost 100% capacity all of the time?
That's a really great question. So I'd have to say, so when I was talking about in that clinical suite, for sure, that would be designed for counseling and for our administrative purposes, but most of that's going to be allocated towards direct services. Our group programming, you know, I could foresee, you know, a possible purpose here and there for that space during school hours, but that would depend on what we were running for clinical programming. So if we were doing groups in some of that group space. So I think we would be open if there was something that we could, that was usable at that time to hear that. Again, one of the main themes here is that the control over that space being under our auspice is the critical piece. It's not something we would want to, you know, give up to somebody else scheduling, and then we wind up fighting for that space or having to compete with other needs.
No, that's fair. And I think that's the way I was thinking about it, that there's almost like a rank ordering, like you get first dibs on that space at all times, and then any other room any spaces that you're not utilizing it, other groups may be able to utilize it. Okay.
Well, and look, to be honest, like in order for us to run the groups again efficiently, like we would want to be able to set up the room, have what we need there. Like right now, like when we have to run a group programming, we're looking for other space. We will consider our own space. Like we've got the kids at our group space here is our waiting room. That's the only space we have. And my staff will have to decide, do I bring all of my materials and everything to a different space because it's a little more space or a nicer space? So it's constant kind of giving one thing up to get something else. So in that future space, one of the main, I guess, goals or one of the benefits would be that we would have all of our materials, the room would be set up the way that we feel like it needs to be set up, you know, whether that's the color of the walls, the pictures, the furniture, all of that conducive to our purposes, which is something we just don't have now.
Okay, thank you.
Thank you.
We have another question from Eileen, if you go ahead, Eileen.
Thank you for that presentation. It was really helpful. My question is regarding the entrances. You're going to need a separate entrance for both locations, for both sides of the building?
So that space in the lower level, yeah, we would need that to be controlled by our staff. And I'm not sure whatever the design will be, whether there'll be like electronic keys or whatever to access spaces. The space on the top floor, we would foresee, if it winds up in that place, an access point that is that you can access through the community center. So like you come up the elevator or up the stairs to that and enter it that way. But we also would need an access point on the other side. If you're familiar with that side of the building, there's a stairwell that goes downstairs.
Yep.
So we would like a private entrance for our people who access our services, who are there and want some sensitivity or discretion to accessing our services. That is something that we deal with now for people sometimes wanting to come in and out of our space and not wanting others to see them come in and out of our space. That's not a lot of the people who come and utilize our space, but you know, especially for folks that are using our social services and some kids that are using our clinic. So we would want to be able to like our staff would be, in my mind, our staff would be responsible for this, a way for people to come into our space, accessing it maybe through the stairwell, that they wouldn't have to walk through a public space.
Okay, and then the hours that you operate, will you be seeing clients, I would assume, during hours when maybe the community center wasn't necessarily opened for the general public, or?
No, I think, my understanding is the community center is going to be open quite a bit. And
Okay.
if we have staff and we're running programs, like, so we run our operational hours based on the town. So we're essentially open as the town is. But like, we're closed now and we've got 15 kids in our room doing a program. So that's tomorrow night we'll have the same thing. Thursday night we'll have clinicians, and Thursday, Friday nights we tend to have clinicians here pretty late, sometimes on weekends. So it's really, it'll be based on the need and our staffing.
So my question then would be, will there be a way to manage keeping your students, if the community center is not open and fully staffed, would you be able to keep your people, do you need a way to close off the building like areas so that we don't have people running through the entire building?
Yeah, I would foresee working that out with Austin. I mean, I think that's kind of a more of a detailed program question that we would, if the building itself is closed and we're seeing people, we would have to work that out operationally. And if there was a limit to seeing, and trust me, there are people that aren't going to want therapy after a certain part of the day, nor are we going to have the staffing. So there'll be a natural limit to what we're doing. And I would foresee working out the rest of it with Beach and Rec for the building.
Yeah, I was just wondering if we would need to consider ways that parts of the building could be closed off for your people.
Well, so if we had that, I guess that would help then to have that other, that other more private access point. If it was controlled to a stairwell, now it would mean that if somebody needed an elevator, it might prevent them from using the space, but
That's right.
at least we would have some ability to offer those services to people through that other entrance.
Got another question from Joe
Thank you.
Paradiso. Thank you, Charlie.
Thanks, Scott, for the presentation. It was helpful. So if the allocations for the lower level and the upper level, roughly 2,000, 3,600 or whatever it is, you covered a little bit. Is that strategic in the way that you've carved that up because of services to be provided there? Or is there other opportunity for, if the architect was able to put, say, 4,000 square foot for you all together on the upper level and maybe just 1,000? Or so is that strategy and the allocations you provided sort of set? Do you need it like that if you cannot be completely co-located?
All of this has been thought out before the community center. So the number of spaces, offices, the size of those spaces, that was all, those plans were created based on all of our needs assessments. So to answer your question, what we're doing really is separating out our prevention staff from our clinic, our administrative and social services components. Because we can put all those components together in office spaces. That's why they're upstairs. Our prevention staff, and again, that lower level, the way that space is configured, it is just perfect. And how it's raw now, but essentially how it is would just be perfect for us. Like, I brought my prevention staff down there and I didn't know what they were going to think. And they were like beaming over, there was just, it's not a lot of light, but there's enough light. You don't feel like you're in a basement, at least in that corner. And how you had a larger space, you had some space behind that you could use for offices. When we started to go around the corner and there's that little, what I think is a little staff space. I actually think I had a PPT for one of my kids in that room many, many years ago. But that little space, so we started to envision what we could do for our clinical groups and how we could design that space a little bit differently than the larger space. Because when we do a lot of social skills groups at this point for younger kids. So some of the materials and things that you could need, you could focus and specialize in that space and not have it mixed and mingled in with some of the other things that we're going to be doing. So like our heads are like going crazy with the possibilities of what we could do for our programming. All of that serves our people and our kids.
So it sounds like, just to confirm, if you can't say put all 6,000 square foot together on one floor, the division of square footage is important to keep it the way that it is, to keep your program the way that you plan to run it.
Yeah, it is, and the amount of space that we need.
Yes, of course. I was thinking more about locations. Thank you. I appreciate it. And thanks again for the presentation.
Yeah, thank you.
AJ, you can go. I was just going to comment at the end, so.
Okay, all right. I just had one final question on my list here. During your presentation, you showed about 36% of your budget allocated to rent and mortgage. Is that expense that is getting transferred to the community center, or?
No, that's so. That was, I apologize. So that slide was our social services and what we purpose the social services funding for. So it has nothing to do with us. That
Okay.
What was a slide that showed that people are using that. I think you were referring to that pie chart.
Yep.
Yeah, so that I wanted to give you an idea of how people use the funding that we do for our social services.
Oh, okay, sorry, I misunderstood.
That wasn't,
the
yeah,
point
that's
of that
not
slide.
our.
Okay, great. Thank you for that clarification.
I'm glad that you clarified.
Joan, are you looking to finalize? Are you looking for a sum up here? You said you were.
I was going to sum up if no one else has any questions, and I was going to make a comment about.
I did have a couple of questions. One is security in general. You're going to be in a building with many other people. Right now, you're in a building all by yourself, and it's easy to control the perimeters. You're going to be in a building now with that could be teeming with people, and so that's question one. Is that, I know it's built into even the youth, the development center. There may not be an entrance, a compatible entrance for that without going through several layers of community space.
It's actually not that foreign to us, Joe. Because we have offices in Memorial Town Hall, which is not as busy as what you would hope the community center will be, but it's a public space. So my office actually used to be in Memorial Town Hall, and I can tell you, people come in and out, and a lot of things happen there that you wouldn't expect would happen there. So I'm familiar, my staff is familiar with that, and we know what we're getting into. I mean, I'll just be honest with everybody. We weren't gung-ho to go into the community center. For one, I foresaw a lot of these kind of meetings and having to explain ourselves, which was not very palatable to me. The more that we considered it and talked, this was the best option we had. So, and as we got further into it, it just felt like it was dropped from heaven. It was really just fit after fit after fit. And so appreciate all the people that have supported us to be a part of the conversation and get in there. So we're ready for whatever comes. Like, we're happy to be a part, and we would look forward to working with Austin and Beach and Rec and doing some co-programming. We do a lot with the senior center now. We do a lot with other community providers. We're designed to collaborate. We just finished a police pilot. We integrated a social worker with the police department. That was something that we did for a pilot last year. So we're all about working with others. That's very much in what we do.
And what are your normal hours and what are your extended hours? I know, I mean, you said town offices. Town offices are open at, they're open at 8 a.m. and they close at 4:30 something.
Yeah, right, yeah,
And they
it's
close at
8
4:30.
Yes, and Thursdays they extend to 6:30, and on Fridays they close at noon.
But then you said you have extended hours in the evenings.
Right, so we're running programming, so we don't consider like the building open or closed. We have staff here that will run a program. If we have clinicians here seeing clients, they then are responsible to open up. They go to the door, they open them up and let them in. They talk with the parents about where to wait if they get there to pick them up. So we control that based on, who's here and what we're doing.
And the last question was about security.
Yes.
It's again an open building, and of course you know the area because you're right next door. But it is an open building. Have you considered or have you thought about a need for security officer or? and it's, I
Yes.
guess it's, and a security officer and staffing isn't what we're in charge of, but it would be a location. I mean, if we need if there's if there's a security presence or a security issue, whether it's a person or alarm system or, as you said, some of the doors that would have to be opened, have a special key fob for opening so that they can be open off during the off hours. That's something we'd have to design in.
Yeah, look, I don't have to tell you all the kind of world that we're living in. So like safety is on the mind of everybody, especially in public spaces. So I would foresee a lot of conversations and protocols, trainings, things that have to get worked into, how we all lived and worked in that space. We do deal with, safety concerns here. We do work with, from time to time, an adult or a youth in a mental health crisis. So like we have our own policies and protocols. I can tell you that whenever we've needed emergency responses, first responders, they are very quick to respond to us and be down here when we need them. So I'm not too worried about that there won't be enough security or that we won't figure it out. I think that we will. I find myself just as anxious as anybody, going in and out of public spaces these days because of the times that we live in.
Okay. Thank you, Scott. And again, thank you for the presentation. I appreciate it.
I would. So, and as you get into more, there are specific things that are important for us within our spaces, things like, whether that's around communication and an intercom system. Well, things I think I'm just looking down my list. Soundproofing, I think, is going to be critical for the whole building, just so, for our purposes, but just as we've talked in the Academy Advisory Committee, that we may have some arts and performance groups that are going to want those spaces. And so if you can imagine a room somewhere in that building that might have some very loud percussion kind of people, you're really going to want to keep that in mind. And for us, because of, that we're going to be running groups, we're going to be talking and doing therapy, that's also important. And I think we covered the rest of the other stuff that was going to be important to us.
And then I'll cede the floor to Joan.
So first of all, full disclosure, I was part of the Youth and Family Services Board at one point in time. I was their liaison for Board of Selectmen, and one of my child went through quite a bit of the programming there. And I have to say that this is a very significant need in the community. The needs need to be met. And quite honestly, when I saw that graph, Scott, from where we were in 2015 to where we are now, it's just eye-opening, quite frankly, the amount of youth that are coming into that are under 10 years old that have the needs. And the therapists that work there, and they go through art therapy and play therapy to be able to get children to open up about things is just amazing. So I think that there's been a lot of thought process. I'm not trying to move anybody, but I want to give an architect the freedom to say, oh, well, if they need this here, I can flip it to this side, or I can do that. I just want to be able to make sure that people going into this are saying, we're going to work with the architect that is brought in, and we just need to make sure that the needs are being met. And this is a critical need for this community. And they have been fighting for more space since I was on the board, and that was 10 years ago. So it is absolutely a critical need, and they make the space fit, but it is a tough timing. And I know exactly the board you're talking about, as far as it's a project manager could not have made a better type of board as far as timing and people and things like that. So I appreciate the time and the people that came to support this organization. It's critical.
Appreciate that, Joan. And I remember you as a board member. Thank you. And if I could just, I thank my board our board that showed up tonight to keep an eye on how all this is developing, and a great thanks to them and my staff. I have an incredibly brilliant, wonderful, creative staff that that does all the work that I spoke to earlier. So great appreciation to them and to all of you. Joe, you're on mute.
Joe, you're on mute.
You're
Still on mute, Joe.
There you go. It took 3 tries. Again, I'd like to thank you, Scott, and thanks for all the work you do. I would like to move to the next item on the agenda. So Scott, you can stay as a liaison member, or we can let you go do your work, I suppose.
okay. I'll hang out. I think you're going to be talking to Bill a little bit, correct?
I'm not until the end, I guess. He's on a public comment at the end.
Well, thank you, Paul.
The liaison and committee member remarks, liaison first, Aaron, I see you're on. Any comments?
I'm sorry, Joe, were you asking me?
Do you have anything to report or any comments for the committee? I know I have a note here that we had talked about the tanks and the status of their permit with the state, or the removal and permitting from the state. Has there anything on that, and anything else that you might want to add?
So no, I don't have an update on the USTs that were identified in the report, aside from the information that Bill had sent, which I thought was an application to the state for removal. So that does still need to be looked into. And I think likely, as we, I guess my initial thought was that from a timing perspective, we would focus on the architects RFQ, RFP, get that done. And then once that was out in the process, or even afterwards, you go through the interview process, then we look into the whole brownfields assessment, that next phase. And
Okay.
based on my understanding of the grant that we received, I think we need to go out and request proposals for that as well. But Mark and I need to connect on that, I think, just to kind of go over some of that language that's in the financial agreement from DECD. And I think the underground storage tanks will likely be addressed as part of that assessment. Mark, maybe you can correct me if I'm wrong on that.
Nope. You're
Okay.
not wrong.
Okay, so that's that's where we are, and I believe that the RFQ, we're still waiting for some feedback from the town attorney and insurance. I have not heard any follow-up from them on that language to give us the okay to post that yet.
Yeah, and I've updated the schedule to reflect changing the submission date. So yeah, we are just, and the feedback that I received from the town on the RFP and the agreements, they were fine. There was nothing in there that was worth, debating. So
do we have a? I'm not muted. Do we have a date for releasing the RFP?
right now, Joe, I've got Wednesday the 30th as a date. Assuming we get feedback from legal and risk. At some point today or tomorrow or Wednesday. But there's flexibility. Again, I did shift and I'll reissue this schedule after the meeting. But I did shift things around to align with the new schedule, and it still gets us on track to select an architect by the end of January, which is what we were targeting to begin with.
So we could likely follow up with legal and Kerma to let them know of our anticipated date and see if they can get us feedback ahead of that. I know the holidays probably delayed them, but I think it was sent what, 2 weeks ago? over a week ago at least.
over a week ago, yeah.
Yeah, so I don't think it's out of the norm to poke them and see where they, if they've had a chance to look at it yet, or at least let them know that we're thinking of it. So we could do that this week.
The Bill McMinn gave me a call earlier today. He's tied up tonight. But he is working on we have three essentially projects going. One is the signs and the doors and the windows to essentially get the signs up to warn people that they can't come in, which gives the police more authority. If they do find someone in it, they can arrest them as opposed to just chase them out. The other is the lights, or excuse me, yeah, the lights and the cameras. Those are in process, but they have not, they should be completed soon. And the third is cleaning the building of the junk that's unneeded. And Bill actually has something set up for that, or can get something set up for that in the month of December, using an outside contractor. So one of the things I realize we haven't done is we haven't authorized all those three projects separately. I believe we did the first one. But I'd like a motion to authorize Bill to do those three projects that I just described, that he has been investigating. And then have a discussion if we have any further information.
So we want to open up the agenda to allow for that motion?
Well, that's, I guess we'd have to, because it's a liaison report. But there's no motion that would have been anticipated there. Or we could wait. Well, I would rather not wait. I'd rather, if I can, open it up to make a motion on Bill's report that he would give if he were here, but he gave to me verbally this afternoon. Joan, do you give us?
So I will move to open up the agenda to allow for a motion for Bill McMinn to do the follow-up. Is that what we're saying?
Yes.
Okay.
I'll second that.
Any objections? Seeing none, the motion is accepted. So can we just immediately discuss the three projects?
Mm-hmm.
Okay. He also mentioned that the town budgets, as opposed to the project, will pick up at least the lights and cameras out of the security budget, and possibly the pulling the junk out. So the cost to the project will be minimal, but I would like to put a number on that as we go as part of this. So, but I'll take any other discussion, and I think Eileen, you had your hand up.
I was just going to ask if we had prices, but you just kind of answered that.
Yeah, the total, as he gave it to me, would be $15,000, but that's not the price. That's not all cost to the project. The project may be about $3,000 to $5,000 of that. So, but I would like to say, I would like to have to authorize as part of this, not to exceed $15,000, knowing that all three projects together are in that range, and the project would be the project that we're on would cover. I think it has to cover the first part of that, which is the buttoning up the building, closing up the windows, sealing, and then taking the doors and making them operable so that there could be both entrance and egress through one of the doors.
Didn't we already vote on that and put?
Yes, that's when we did vote on.
Okay.
So that doesn't have to be voted on separately, or we could just vote on the other two. I'm amenable to either.
Yeah, I would think we wouldn't have to vote on it again, seeing we already voted on it.
Okay, so the other two, so that would bring down the not to exceed to approximately 10,000.
Yeah.
And some or all of which may be covered by the town security budget and or the town maintenance budget.
So I'll make a motion that we approve up to $10,000, knowing that potentially none of it will come against our budget, but there's a potential for some of it to come against our budget for the cameras and the cleanup, correct? Those two?
Camera and
Interior.
lights. It's exterior lighting and then cameras to pick up anybody who might be an intruder.
Okay.
I said,
Okay. Any further discussion? Any objections? Then all in favor? Joe, did you have your hand up or you? What did he say?
So I was on mute. No, I did not have my hand.
You have, well, I guess if are you abstaining or are you a no vote?
I'm go vote. No, I was.
Joe, we didn't understand a word you said.
Yeah, your Wi-Fi is cutting out significantly. So if maybe you can type in the chat what your vote is.
I think Joe's frozen now.
Can you hear?
You're frozen on our end. Oh, yes. Okay, there we go.
Okay. Got it.
Thank you.
So I believe that was, we have 6 people here. Dave's no longer with us, so that would be unanimous with 6 votes. Okay. Are there any other, I guess that's, I guess, Mark, you're a liaison. You would be, I'll put you in the liaison category. But I think we've already heard from you that the RFP is, we're waiting final reports or final review from legal and insurance.
Well,
And-
legal we have, it's just risk we're waiting for at this point.
Okay,
And anybody else, I mean, I know we submitted the document to the entire committee, if there's any other feedback, but yeah, we're just waiting to hear from risk.
Jacqueline, do you have any update on that? I know we,
Yeah, she was gonna reach out to Lauren. She did copy Lauren earlier this afternoon, and she was gonna follow up with Lauren tomorrow.
okay. Any other thing that would, any other items that would kind of be a committee remember remarks or liaison? Or can we move on? Okay, we have a discuss the Academy Community Center Advisory Committee survey. I don't know if we need to discuss it much. It's out. So I don't know if anybody has actually looked at it yet. I have looked at it and I filled it out as a member of the community and not as a member of this committee. I essentially have no comments on it. I am kind of neutral on it.
I thought it was very well thought out, and it's actually provoking some good discussions on Facebook and getting people, we kind of tried to share it to as many community Facebook pages as possible. So the biggest topic of discussion right now are the outdoor 24/7 bathrooms, at least on Facebook.
Which is there a Town of Madison Facebook or?
Oh, there's the town website, but then there's Madison CT, which has about 8,500 followers. There's Madison, Connecticut. There's the real Madison CT. There's the really real Madison CT. There's the political, there's at least 6 to 10 Madison sites, and we tried to push it out as much as possible, so that people are aware that it's there.
Okay,
Did it only go out through Facebook?
No, so there was a notification from, if you're on, you get your notices from the town of Madison. It was talked about, also Peggy's notification that went out, the first selectwoman's notification. So it's really been pushing, and I think, correct me if I'm wrong, I think there's even some postcards or something talking about it as well. So we're trying to get, and I think there was something in the newspaper,
there was
maybe,
something, patch, there was a link in the patch.
right?
Supposedly they were taking the cards to the Madison Turkey Trot, which I did not go to this year.
I was on the
They
Cape.
were downtown on Saturday also, handing them out.
And aren't they also handing them out at the Christmas tree lighting?
I would assume so.
Yeah, I didn't see him at the turkey trot, but there was a lot of people there, so it could have very well been there.
Oh,
Do we want to ask
I
our
was-
advisor?
actually, what I was going to do is, since we've already taken item 6 and moved it up, and then item 7 would be public comment, to invite Bill Stableford if he's on, or any other people from the committee who are on, to maybe give us an update on how it's going, or if it's meeting or if they're measuring the number of responses. Bill, anybody? Bill Stableford, how you doing, Bill?
Ta-da! Good evening, everybody.
Evening.
Thank you so much. Appreciated all your questions for Scott, and very perceptive. And in terms of the survey, I'd like you to keep in mind, our committee was not able to meet for its first meeting until September 29th. Since then, we've met weekly, and our first priority was to create a public survey. That will be one of several elements and efforts that we will make to reach out to the public and to seek their input. I give a lot of credit to our committee member, John Lamourand. He's our survey guru. I believe he's on the call, and he is managing the technology for the survey. Yes, we were definitely at the turkey trot. We were handing out, we printed 1,000 postcards instructing people how to get access to the survey. So we handed out a lot at the turkey trot. We tried to screen it for Madison residents only. We also had people at, as Erin said, at the Santa and the Small Business Saturday. We will be at the tree lighting, handing out the postcards, and the Madison ABC holiday concert. It's going out through multiple media sources, and speaking of source, we expect an article this week in The Source, and John Lamourand and I spoke with Ben Rayner, so there should be an article coming up soon. And oh, there's John. Hi, John. And we will be inviting representatives from activity groups to our meetings in person to describe to us what particular features they would most prefer to see in the building, such as a theater group, a music group, vocal music, instrumental music, arts groups, and outside organizations such as Shoreline Arts Alliance, the Neighborhood Music School in New Haven, which has expressed interest in using the building. And so we're going to continue our outreach and collecting of information. And if you've looked at the survey, you see that it's open until January 13th. So far, we have almost 600 respondents, and we hope to get several thousand. So I'll stop there and happy to answer any questions.
John, did you want to add anything?
No, I think Bill covered it pretty well. The focus of the survey is primarily to identify the things that your committee needs for building and room configuration. So we're trying to get that done as quickly as we possibly can.
The timeline for getting an architect on board is the end of January. So actually,
Yes.
the two the survey and the hiring the selecting the architect are pretty much on a good timeline together.
Yeah.
Because you should have your information and be able to analyze it to some extent, digest it, and then at some point they provide that information to the architect.
Yeah, the survey is, as it collects the information, it's doing the analysis in real time. So it's displaying what the results are for every survey that's come in at any time that you look at it. So we're hoping that the July or January 13th cutoff will be well down the road of the data analysis as well as just the collection.
Al, do you have a question, or are you a liaison member with a different?
I was going to ask Bill and John if you've thought about how and when you're going to start sharing the findings of your survey.
Good question, Al. The way it's set up now, and I'll defer again to John, our committee members are the only ones who can see the incoming data in real time. And we plan to keep that private so as not to influence any future respondents until January 13th. Select people like you, I'm sure we could find a way to share that if you're interested along the way. John, would you add anything to that?
No, we've been asking as part of the survey, if people want to have the results of the survey after it closes, that we would send it to them directly. But again, as Bill said, we don't want to influence the results of the survey, but we could do selective sharing at any time.
I was going to suggest that our two committee chairmen, Bill and Joe, talk about how and when that information is passed from one committee to the other, and whether that should take place before any public dissemination. I don't have an answer to that. I just don't want us to be surprised at the last minute.
I've already given that some thought, Al, and I agree with you. And I think on a selective basis, we'll be happy to share that with Joe and any of the other committee members. If you guys would find it helpful in, doing some advanced thinking about the types of activities that the public.
Bill, if you can hear us,
wants to see in the building.
there you go. Could you repeat that, please, Bill?
Pardon
You were frozen. Could you repeat that, please, Bill? You were frozen for
Oh.
some amount of time there.
Sorry that happened. I agree with Al. I think it would be a good idea on a selective basis to share some of the real-time incoming data with you, Joe, and other members of your committee, if that will help guide you in terms of there are already some very clear trends about strong preferences for the types of activities that the public would like to see in the building.
Okay. We can talk about that Friday.
Sure, we'll talk about it on Friday.
I think it is important to note too that there's a couple steps to the process. One is collecting the community input, but the second is determining what rooms could be allocated for those defined purposes and what are the configuration aspects of those rooms that need to be there to support them. So we're planning to collect the data with that January 13th deadline, and then in the meantime, start working on collecting the data about room configuration requirements.
How has the response rate been so far?
We've got 550 responses as of right now.
Jay, I believe AJ has a hand up. Go ahead.
Yeah, the discussion is got a question ruminating in my head. We had a discussion with Scott Cochran on the Youth and Family Services use of the building. And as you know, the community gets more awareness of this, and the different groups get awareness that there are groups that have space here. Is the advisory committee going to be, working with groups that may want dedicated space, or are we going to have to anticipate other groups coming forward that say, I should get dedicated space, or my group should get dedicated space in the community center? Is that something we should be concerned about?
Well, yes, we're going to be inviting representatives of activity groups in. We on the advisory committee are clearly aware that we are advisory only to you folks, and that all final decisions about space utilization and allocation of specific space will be in your hands in conjunction with the architect and the OPM. So we fully respect the different roles that our two committees play. We will not be in a position to guarantee any activity group a dedicated space. And we've, I've been involved with this since 2019, and we've on the original committee, and we've made that clear from day one that there are no no guaranteed spaces here, and the final determination will be in the hands of your committee.
Thanks, Bill. I guess to clarify, I'm thinking more about, is there a process through which people would approach your group, and then your group would approach us and say, here are the list of the groups that would like to have space either temporarily or permanently dedicated, and here's why they want it. And then we can take that information and make decisions on our behalf, or are some of those groups going to come directly to us?
Well, I think you outlined it perfectly, that they'll probably, we're going to invite them in, they'll let us know, and then we'll collate, synthesize the data, try to make sense, try to present it to you folks in a way that makes the most sense in terms of the priorities of the public. That's what we're trying to assess.
Perfect. Thank you.
Let me give you a quick example. If 3 people in town on the survey say that they want to work on pottery and they would like to have a kiln in the building, that's not much. But if 250 people come forward and say, hey, we really want to do pottery and we want a kiln in the building, well, that tells us something more significant, and we would pass that priority on to you guys.
Any other questions for Bill? Any other comments?
Well,
One of the
thank
things-
you all. I look forward to when our two committees can meet conjointly.
That's just gonna mention that. One of the things Bill and I have talked about is having the committees meet together as a formal meeting, as a town meeting, not for drinks at Brother Mike's. But we would like to come up with some idea of that date in the future, and I don't know if we have any proposals for it, but one of the dates that I looked at was December 27th. That's kind of we have a meeting that date. It's a couple of days after Christmas, so that may not be a convenient time, but I don't think we're going to have any of the Mark, I don't think we're going to have anything to do on December 27th in the RFP schedule, right?
No.
Hey, Joe, our committee meets this Thursday. I'll mention it, and on your and my and Al's Friday discussion, we'll see what we can come up with.
Okay. Any other comments or questions? If not, we'll adjourn the meeting. I think I can adjourn it by asking if there are any objections to adjourning. Hearing none, our meeting is adjourned, and I would like to thank everyone for your contributions today. And we can stop the recording.
Thanks all.
Guys,
Good
Thank
evening,
you,
all.
everyone.
see ya.